appropriate treatment and care are essential for reducing the likelihood of mother-to-child transmission of HIV. Therefore, it is important that care providers know how to effectively engage women in care.
HIV is a specialized area, and so even though there's communication around different pieces, not everybody is comfortable or able to answer all of the questions all the time. It's a matter of building capacity.
And I feel that that's what the doctors really need to do, is they need to get on a personal level with their patients and explain with them that you do have a serious illness, but your serious illness can be controlled. As long as they're taking their medications and as long as they're doing everything they need to do, that they're going to be healthy, they can live normal lives, they can have babies, they can have kids that are going to be 20 years old and working and having good lives.
When a woman comes in who is HIV positive and pregnant, my goal for them is their goal as well, to have a healthy baby and not to transmit that HIV to their child. In order to do that, I don't work alone. I work with a huge multidisciplinary team of healthcare professionals here at the clinic and as well within the community to do that.
The biggest advice that I would have for healthcare professionals is to treat that patient like a person. They are important, so it's really listening to the patient and taking the time to tailor their treatment for them individually.
I think that having continuity of care and building that trust and not having to tell their story over and over again helps make them comfortable and feel safe.
Keeping them engaged is being able to really take them where they're at and walking with them and beside them, not saying you need to do this or you need to do that, providing some options, and making sure that you work with the dads as well and work together as a family unit. If you've built a strong, trusting relationship, they will continue with you. If you betray their trust, you may have lost them.
When we see a woman, every time we see her, we touch her because we're always touching the belly and measuring her baby and listening to her baby. And I can tell that a lot of women aren't really used to somebody touching them. And I think that once they become HIV positive, they start limiting the amount of personal contact that they have with people. And so even as a care provider, to show absolutely no hesitation about touching somebody with my bare hands and listening to their baby in the same way, for them it's very reassuring. And I think that it's very humanizing for them. And sometimes this is a condition in which they haven't felt that human. If they can find that their care provider is accepting and non-judgmental, they're much more likely to engage in care than somebody who feels that their care provider isn't non-judgmental.
Sometimes when we approach a client, we're inherently in a position of power. We're standing above them while they may be laying in the bed or sitting in a chair. So being able to sit next to them or sit near them and have a one-on-one conversation, making eye contact, I think is really important. Simple things, as simple as introducing yourself with your name. Trying to understand the barriers that have brought the person to that position that they're in or that life that they have, and look at the opportunities.
We keep the woman who's pregnant as the team leader, and the rest of us who are working with her are actually the rest of her team. And so we work as a circle of care. As she's going through a pregnancy, we all move with her. And at some points, she may need some supports more from outreach, so those people step up and the other group kind of steps back a little bit.
Building relationships with your outside agencies, I think it's crucial, and anybody that's working with pregnant women is knowing where else they can access their services. And I think some of the women are coming to us because we built relationships in other communities. So they're coming from outside of the community and we've built those relationships.
I think one of the things that we're really good at is working opportunistically. So if somebody finds out they're pregnant, they can come in right away and be seen. Because we house outreach in our building and we have access to lab, all those things can be done in a process quickly and right away and done at the right opportunity. Everything that they need is at one place.
Stigma and discrimination are huge. It's, I think, the largest reason. I think that some women don't engage in the prenatal care to begin with. There are reasons that people don't get tested, don't seek care on a regular basis, and they're back and forth between different communities. You know, trying to break down the barriers of stigma and discrimination with healthcare providers is challenging. But the reality is people need to be given the chance, and it's our job, I think, to be able to support people. Providing care to a woman who's delivered a baby, even though she might be living with HIV, is really no different than any other woman who's delivered a baby.
She can take a baby home with her and is the best person to take care of a baby. For those that struggle, often having a child to care for is a motivator for them to engage in care, often for the first time. As a care provider, that's an extremely good opportunity to make a good relationship with a woman so that once the baby is born, that relationship can continue and she can remain engaged in care.